So it gives me great pleasure to welcome Dr. O. Dr. O is the Medical Director of the Cardiovascular Prevention and Rehabilitation Program at Toronto Rehab and the Peter Munk Cardiac Center. And he's also the Good Life Fitness Chair in Cardiovascular Rehabilitation. Welcome, Dr. O.
Thank you very much, Arlene. It is indeed a pleasure to be able to join you this afternoon, along with so many of our friends and colleagues online. We've had a lot of attention, obviously, to COVID and its complications and prevention. And one of those really important aspects is that we do look after ourselves and our families and think about important behavioral aspects like healthy eating. So we're delighted that you can join us for this important session in particular. The agenda for this afternoon, or for the next hour, will cover these important topics. I will start off the discussion with just a little bit of background about why healthy eating matters in Canada and where are we in terms of a nation, in terms of consumption at this point. My colleagues are much better informed in these areas, and I will introduce them in turn at their sections, but we are very privileged to have Nilu and Carly with us today as nutrition experts to touch on these topics of a bit about COVID-19 and nutrition, talking about why dietary patterns actually might make a difference to your long-term health and what does the evidence say, how this might all come together in the most recent version of Canada's Food Guide. And then when we operationalize that at home, how can we bring in topics in nutrition for the plates that we serve to ourselves and our families? And as Arlene has introduced, that we will be conducting a Q&A session through the end of this. So please do fill in some questions as we move through the topics. And you'll notice in the bottom of your Zoom control, or sometimes at the top, that there is a Q&A feature where you can type in your questions, or you can, as Arlene said, you can just email them into trf@uhn.ca. Okay. So setting some of the landscape, why do topics like eating matter? Well, we are all touched by chronic diseases in our workplaces, in our homes, in our families. And certainly for those of us working in the healthcare landscape, we see people on a regular basis living with chronic conditions. Public Health Agency of Canada would suggest that for adults over the age of 20, as many as 44% of us live with 1 of 10 chronic common conditions. And as we get older, in fact, living with a chronic disease is the norm as opposed to the exception. And the range of disorders come from cardiovascular disease with heart disease and hypertension to metabolic bone conditions like osteoarthritis, osteoporosis, mental health conditions, anxiety, depression as examples, diabetes, asthma, cancer, mental health conditions. All of this is going to be very, very important in our lives. And it's important to think about ways that we might modify that. I did see one question pop up at the bottom asking if this presentation will be made available. Indeed, it will. Stay tuned for information on where to find this later on. So we have lots of chronic conditions in our communities, in our lives. If we could actually think about one step back about the risk factors or the modifiable behaviors that impact upon chronic diseases, that might be a nice solution for us. And as we are spending time at home in this day and age, then we might think about some of the things that we can do on a daily basis. So we are aware that there are some non-modifiable traits that might influence whether we develop heart disease or cancer as diabetes as examples. So who's been in our family lineage, how old are we, biological sex and social gender may play some roles here. But there are also many things that we can do in our daily lives that influence our health trajectories, including inactive lifestyles, whether we smoke or not, how much we drink, how we cope with the stresses in our lives is very, very important. And the topic for today that we want to highlight is the foods that we choose to put into our bodies and how unhealthy eating actually impacts on the development of chronic disease. unhealthy eating has been associated with a range of those chronic conditions, including diabetes and cardiovascular diseases and cancer and brain health. And the thought is that up to 80% of premature deaths from heart disease and stroke can be prevented by two major health behaviors: eating well and being active. So it is indeed worthwhile paying attention to the nutrition part of the spectrum as ways towards health. Where are we in Canada? Well, statistics from the Public Health Agency of Canada, Heart and Stroke, and Health Canada surveys tell us that more than half of Canadians 12 years of age and older consume less than 5 fruits and vegetables per day. So we aren't getting enough fresh produce, and that then leads to us not getting enough important nutrients like calcium and magnesium, important for bone health, potassium that's involved in all kinds of systems in our body, including how our muscles work and our heart beats properly, important vitamins for bone health like vitamin D, and getting enough fiber that's important for the health of our digestive system. So there are important immediate health effects. If we look at another snapshot of dietary patterns in Canada, you'll see in the green part of this pie chart, what's highlighted is about a third of us will spend, or a third of our daily energy intake is spent around unprocessed or minimally processed foods. These are fresh fruits and vegetables, for instance. But the majority of what goes into us as a typical Canadian are these things like ultra-processed foods that have high sugar, high sodium, less nutrient value to them. And clearly, there are strides that we should be thinking of and putting into play in our daily lives in order to improve our health moving forward.